The Stars and Stripes show is brought to you by the U.S. Embassy.
Well, it's Gabs FM, powered to engage your world. And of course, welcome to the Stars and Stripes radio show, proudly brought to you by the U.S. Embassy in partnership with Gabs FM. And of course, this is where we highlight the bilateral relationship between the U.S. government and of course the BW government. And today we turn our attention to a crucial health issue that affects women in all nations. And of course, whether you're American or you're Botswana, these issues also speak to you. And of course, cervical cancer. Join us as we explore the impact of this particular health challenge and the collaborative efforts between the United States and Botswana in combating it. And of course, we have industry experts within the health facility. And of course, have you, what's your take on cervical cancer?
What's my take on it?
No, as a woman, as a woman, it's very important I ask you that.
The older you get, you're encouraged to have regular pap smears, right?
Okay.
That's what I know.
How many pap smears? Once a year or twice a year?
Okay, let me speak personally. The last one I had was last year.
Okay.
Yeah.
And you also...
I'll ask the doctors here when I'm due for my next one.
Fantastic.
I'm the expert, so yeah.
All right. Moving swiftly along. Let's start with the Meet America policy discussion, and where we're speaking to our good friend, Dr. Jared Umolo, who serves as the Deputy Branch Chief of HIV Clinical Services. Dr. J, I haven't seen you this year, so I'm going to say Happy New Year and welcome to the show.
Thank you, Swift. Happy New Year. Always a pleasure to be here.
Absolutely. Who are you supporting for the AFCON, may I ask? Don't offend me, huh?
It's been a bit tricky, but of course, the better players, the better teams that play the better exciting soccer is the one we go for.
I like that neutrality.
Let me tell you something. That is exactly what you call diplomacy.
Right?
Stay neutral at all times. But thank you so much, Dr. J, for taking the time to come and be part and parcel of the show. And of course, the month of January is actually Cervical Cancer Awareness Month. And I'd also like to encourage Borre to keep their ears wide open, whether we like it or not. The gender connection is such an important conversation to have. You may not be a female, but you're married to one. You may have a mother, you may have your daughter. So these conversations are always interlinked and need to always interlink. And of course, thank you so much for being part and parcel of the show. Look, Doc, let's just touch on what you do at the U.S. Embassy and of course your connection to PEPFAR and HIV and AIDS, and correlate, what cervical cancer and the correlation between cervical cancer and of course HIV and AIDS.
Thank you so much, Swift. So maybe first things first. What is cervical cancer? Cervical cancer is a cancer that affects the cervix, that is the lower part of the uterus. Sometimes you call it the neck of the uterus. And it's the most common cancer among women worldwide. And it's a critical issue because it's the leading cause of death in many countries, including Botswana.
Jeez, I had no idea.
So in Botswana, among women, cervical cancer is a cancer that leads to most deaths. Actually, in 2022, it's estimated that there were 454 new cases and 253 deaths occurred. We're talking of 5 women every week. And so it's a big challenge. For us, it's a big concern. We also do know that 90% of cases are linked to what we call the human papilloma virus. That's a sexually transmitted virus. And you asked the question about the link with HIV and the work that PEPFAR does.
Yes.
PEPFAR stands for the President's Emergency Plan for AIDS Relief, basically supporting HIV prevention and care of those who have HIV, who are living with HIV. Cervical cancer happens to be a lot more common among those who are HIV positive. Actually, it's 6 times more. Women who are HIV positive are 6 times more at risk of cervical cancer. But the great news that we bring here, and which is perhaps the more important aspect, is that cervical cancer gives us a chance for prevention. Not many cancers do. But cervical cancer, if there is screening and it's identified, the cells that are developed to become cancerous are identified in time, we do have a great opportunity to treat it and prevent its progression to full-blown cancer and death, which we are trying to prevent.
It's Gabs FM Power to Engage Your World. We still continue the conversation on cervical cancer, and I think it's about that time where we bring in Re Tiraona Khaswangan from Bumi. And by the way, do you pick up on that surname, Swift?
Pardon me?
Did you pick up on that surname?
No, I didn't.
Khaswangan.
Oh, yes.
Ah.
Oh, maybe he's part of a shareholder of the Republic of Gabs FM.
He is, and I was told before we got on the show that somebody's going to be listening intently because Armasika Amo Studio. So let's just bring you into this very important conversation, Rekhaswanyane. And for those who don't know, let's just talk about what it is that you guys do, Go Bumi. We know that you are working very closely with PEPFAR, CDC, implementing partner PEPFAR. What do you do there for those who have no idea what you do?
Yeah. Thank you, Samantha, for that question. So let me just start by saying Bumi, as a PEPFAR-funded implementing partner, we work to support the Ministry of Health in many HIV programs.
Okay.
The Ministry of Health have. Amongst them were PrEP, HIV testing services, and also TB and cervical cancer,
yes,
which is the topic of today. So one may ask, why cervical cancer?
Yes.
HIV and cervical cancer. So now it's because of the burden of disease of cervical cancer on HIV and women living with HIV. So that is why now we want to offer that comprehensive care as Ministry of Health and as implementing partners supported by PEPFAR in Botswana. So like Jared mentioned, a woman living with HIV's risk of developing cervical cancer are 6 times more than their HIV negative counterparts. And the cases that we actually see as confirmed cancer, over 60% of those are women that are living with HIV. So taking into consideration those factors, Bumi now supports the Ministry of Health in 17 districts across Botswana, and the support comes in the form of direct service delivery and technical support. And we will get to that as we go on the show.
Definitely. I wanted to bring in Dr. J. Would like to know, are there any ways that we can prevent, are there any preventative measures that we can put in place when we're looking at cervical cancer?
Thank you, Samantha. Actually, that's one of the exciting things about the cervical cancer conversation. And we have different prevention approaches. One of them is what we call the primary prevention, where you have vaccination against the human papilloma virus that I mentioned earlier is associated with cervical cancer. So the ministry conducts HPV vaccination for girls aged 9 to 13. So that is a great preventive opportunity. But we do also have what we call the secondary prevention.
Okay.
And this is where we have the screening and treatment of those lesions, which then go on to become cancer. And this is where the PEPFAR and CDC support, in collaboration with the Ministry of Health and the implementing partners, comes in. The interventions, as Tiro was mentioning, include actual screening, supporting the actual screening by providing staffing support, increasing awareness, training. We are constantly striving to increase availability and use of screening and treatment services, especially among the HIV positive, who, as we've said, are most at risk. And we've been targeting those who are between the age of 25 to 49. That's from the PEPFAR perspective because of the HIV-related support. But of course, the ministry supports across board,
yes,
everyone every woman who is at risk of getting the cervical cancer. In the last 6 years, PEPFAR and the CDC has provided over $6 million to support the cervical cancer screening programs. And during this time, we have supported, in collaboration with the Ministry of Health and our partners, we have supported screening for over 90,000 women, and nearly 50% of them were actually first-time screeners, showing us that actually that was really critical for increasing the opportunity for the screening. 5,000 of those who are screened had what we call the positive result. They had the precancerous lesions, and over 80% of them have been treated during that period. And so we see this support as really contributing to preventing deaths, really tackling the challenge of avoidable death. But the reason we love coming back here to keep talking about it is that we are not reaching everyone.
Yeah.
And so we still do need to continue expanding opportunities and send the message out there so that women can come for the screening. As a medical doctor, I've had the misfortune of coming into contact with a woman who is coming late to the facility when it's already end stage cervical cancer, and it's devastating because by then there's really not much you can do, and it's all about hospice and end of life care. But we do have a chance. We can do the screening in time and treat the lesions and prevent the cervical cancer.
Allow me at this juncture to bring in another important voice into the conversation. And of course, we need to hear from the voice of the BW government. And representing the BW government from the Ministry of Health is Dr. Kula. Dr. Kula, you've been listening. How are you, sir? And welcome to the show.
I'm fine, sir.
Fantastic. Thank you so much for being able to contribute to this important topic that is cervical cancer. Look, we do understand that cervical cancer is treatable, but let's touch on what are the issues being faced by Botswana on the ground as a foot soldiers on the ground, and your vantage point. Why do we still have women dying of something that is completely avoidable?
Oh, thank you. Thank you very much. FM to give us the opportunity to talk to the listeners and about this cervical cancer issue in Botswana. First of all, I would really like to thank the partners, all those stakeholders, especially those from the PEPFAR related services as support. We have made really some significant strides in the cervical cancer. I think you also heard when Dr. Omolo talked about the numbers that have been screened.
Yes, sir.
Because if you look at it, those 90,000, that will be the lives that has been saved from cervical cancer.
Absolutely.
So it's a good, significant numbers that we really appreciate as a government of Botswana and Ministry of Health. And also now, with the cervical cancer, it is one of the cancers that can be screened. That has the opportunity, as the doctor said, it has the opportunity to be able to see those signs before it really becomes cancer. So it gives us the opportunity to intervene before it really becomes a cancer. So now we are still seeing the low uptake of the service from the community or from the society. But we have seen that what is causing that. One of the reasons is the perception. Some people don't perceive themselves as being at risk. Yeah. So if somebody does not perceive themselves as being at risk, they will not take the initiative to go and access the service.
So is it fair to say that a lot of education needs to be done around the topic of cervical cancer, including us in the media fraternity? There's a lot more that we need to do to help you, obviously do your part.
Definitely. Because, you could sometimes, the way of sending messages, it differs. But the most important is which message, when it arrives to somebody, that individual took action and...
Hello? Hello? Dr. Kula, do you have another radio device close to you? I don't know what just happened, but let's take a quick break and then we'll definitely get a hold of Dr. Kula, where we are discussing cervical cancer. And I think on the other side of this, I'd also like to ask you, gentlemen, just as men, what we are doing, the three of us, to create awareness around this topic. Some of us may have daughters, some of us are married to women, some of us, have sisters. These are conversations that we need to have as Borre in terms of what are we doing in our daily lives to, educate our male counterparts to say, gentlemen, come into the sphere of understanding that cervical cancer can cause the loss of life. Good afternoon.
Kasani. Power to engage your world is on 97.7 FM.
And that's the DRE. Right back up on top of things.
It's Gabs FM, power to engage your world. He goes by the name Andre Young, otherwise known as Dr. Dre, and this one is titled Still Dre. Actually, Jay-Z just received an award called the Dr. Dre Global Impact Award, and of course he had a lot to say, but this is neither the platform. Today we're talking simply cervical cancer, and we're just talking about and trying to get an understanding of what is going on within the Republic. Remember, you are on the Stars and Stripes radio show, proudly brought to you by the U.S. Embassy in partnership with Gabs FM, and this is where we highlight the bilateral relationship between the U.S. government and the BW government, talking shared health. And of course, you must understand today we're in a better place when it comes to issues related to HIV and AIDS, and this simply is on the backdrop of collaboration between the U.S. government and the BW government. And today we're going to be discussing cervical cancer and its relationship to the Botswana. And of course, Dr. K, I got you back. My sincere apologies. We lost you. I think you are still in the middle of, your contribution towards the show.
Yes. Yes, I was just explaining that the other issue that we see is the perception, where people don't perceive, when individuals don't perceive themselves as being at risk.
Okay.
So, yes, what I can just say is that if an individual is a female and they are 25 and above, that they should just perceive that as a risk so that they can now go and screen so that they can be prevention. The other issues why we are still having these cancers, we see them, even though cervical cancer is preventable, is the issue of accessibility. So we are screening the same people again and again, what we now call them routine. But we have, from 25 years of age and above, we have close to 800,000. But so far, we have screened less than 100,000 in 5 years so far. And these people, now they're becoming routine. We are screening the same people. So the question is, where is the other 700 plus? So it's the issue of access. Access, some people don't have access to where these services are provided. But as a government, we are also really increasing the access, or we're increasing coverage by making sure that these services are provided across the country and as much as possible. The other thing that also can be affecting access is that you may find that some people, they are 8 to 5 kind of job, Monday to Friday. So when it comes Saturday and Sunday, they are doing some other social or work, home-related, so they don't have time to go and screen. Because if you go and screen, it's something that you don't have pain or anything. So they don't have time to go there. So that also affects their access in that way. So, and then the other thing also that also affects the provision of these services of prevention of cervical cancer is the human resource on the side of the Ministry of Health. We have special providers or special healthcare workers that they provide this type of knowledge and service to the people. But now and then, the people are mobile. So, and we are also training a lot. We are training a lot so that they can also meet the demand or the coverage of those people that we're supposed to provide the service to. So we, as a country, also as Botswana, we have also subscribed and to the elimination of cervical cancer, which means in all we are supposed to be seeing at least 4 cases of cancer per 100,000 women in a year. but currently we are still seeing a good amount, maybe around 30 something in a year, type of cervical cancer cases.
Well, it's Gabs FM Power to Engage. Well, I think Samantha asked a great question in terms of the education sphere and the power of the classroom, teaching some of these. Would you care to explain further on that?
And I asked that because off air we had a conversation. Unfortunately, Dr. K, and I was asking our guests in studio, we're talking about just how is there any plan to, cross-collaborate with maybe the Ministry of Education so that this conversation can start from high school level. I personally can attest to the fact that when I was in high school, this was not a conversation that was had. I only found out about this conversation when I was way older. Is there some sort of cross-collaboration across ministries that's going to happen? Is it happening?
Let's give that one to Dr. K and then we'll bring it to the gentleman in studio. Dr. K?
Yes.
Would you like to speak to that?
Yes. Thank you very much for that question. What are the strategies that are in place since we are seeing that education is not reaching to the people maybe as much as we would like to? So there's a collaboration with some of the ministries. I will say we have collaborated with Ministry of Education in terms of sexual and reproductive health as a department, which where cervical cancer falls within it. But we have also collaborated with some of the ministries, like the state of presidential office.
Okay.
Yes. So because we also thought in that way, influential figures can also maybe help us to reach those that we cannot reach, and the gatekeepers, and can help with the gatekeepers to those other individuals that may need gatekeepers to allow and also maybe to motivate those individuals to see what will really happen to our new screeners or first-time screeners.
Okay, great.
Absolutely. Let me offer our two doctors in studio the opportunity to contribute in line with their education. And of course, share your thoughts. Sometimes, we have teachers that are listening to Gabs FM, and were so many elements or stakeholders within the framework of the community that is the Republic of Botswana, and we all need to do our part. This issue is not a U.S. government issue. It's not a BW issue. It is our issue. Dr. Jared?
Thank you, Swift, again. So, like already noted, one of the biggest challenges is awareness. And we do know that if we relay the information to the younger people earlier, it sort of sticks in. And so that's a realization that we are also coming to and widening the scope of who can we engage to expand the messaging some more. Just earlier this week, we had what we call the PEPFAR stakeholders engagement.
Nice.
So it was an exciting opportunity to speak to the various stakeholders in the landscape and hear what the priorities are and expand on the opportunities to share messages and be able to do what we do better. So in that forum, we did have representation from a wide array of ministries, including Ministry of Education, Ministry of Youth. We had the National Agency for Health Promotion, NAPA, and so we will need to strengthen these partnerships and continue to work together to make sure that we expand the awareness in all the available fora. There's a robust education health program that we can leverage on, as Dr. Kula was saying, and make sure as we do the HPV vaccination, we are also sharing messages about other opportunities for prevention. It's unfortunate that we are not reaching everyone while we have the tools to prevent these deaths. But we can only keep pushing.
We can only work together to spread the message. It can never be your responsibility alone.
Yes.
It is all our responsibility. Red Tiro, what is your contribution towards that?
Yeah, no, thank you for that, Swift. And yeah, I know my colleagues here have already mentioned that we still have a lot to do, especially going into the younger generations at school. We also have this part of our community that we are not really getting involved in terms of reaching with education, which is men. So, as we have mentioned earlier, HPV is sexually transmitted, which goes without saying. Men get it from women, women get it from men, although it doesn't do the same damage that it does, or for a lack of a better word, it doesn't affect men as much as it affects women.
Yeah.
So now again, if a woman goes for screening, there is an opportunity to get treatment. And there is treatment education that goes in after that. And it involves avoiding other things to allow healing after treatment, and that speaks to sexual intercourse. And we know that some women may not really be comfortable with that, and some men may not be comfortable with women spending a couple of weeks without having sex with them. So we are not bringing these men on board enough, and this is one of the strategies that we are getting into to get male involvement, to support and encourage their female counterparts to go for screening.
Absolutely. And I think, I like what you're saying. Sometimes us men, we feel like certain topics we shouldn't talk about, But personally, my friends and I mean, there's three of us. We all have girl children. And, we sit and have uncomfortable conversation about, like, how do you bath the girl child? And keep ensuring that hygiene is an important part and parcel of the girl child. Let me ask you this question. We saw men in football, for example. We need to bring the cervical cancer conversation into our world. What are some of your recommendations? I mean, the two of you are foot soldiers on the ground, whether we like it or not. The two of you live, breathe this topic of cervical cancer. But what would your advice be to men? Some men are fathers, some men are husbands, some men are uncles, some men are sons. How can we, for lack of a better word, pull our socks up to play our part in terms of awareness? Let me give the platform to Dr. K before we love and leave him. Dr. Kula, can you just speak on that particular topic before we love and leave you?
Yes. Thanks very much. Because you see, men, we men, we are very important stakeholders when it comes to cervical cancer. We are also at the same time, we are the gatekeepers. I mean, we are influential to these females that we live with or we live around. So it is very important that if we do understand as men, we are empowered with knowledge and skill. I believe that as men we can bring a significant steps towards ensuring that there's prevention of cervical cancer.
Okay. Thank you so much, Dr. K. Thank you so much for being the voice of BW government. And on behalf of many Botswana, would like to thank you for your contribution. I think one thing that we need to continuously celebrate is our unsung heroes, which are people in the health sector, the people who are doing everyday work in order to ensure that Botswana are healthy. Thank you so much and have a fantastic afternoon.
Thank you, sir.
Thank you, sir. And of course, let me give it to you, Dr. Jared. In your opinion, what can we do a lot more, man on man? What can we do a lot more to play our part in, creating awareness and educating people? I love what Dr. K said. He said, whether we like it or not, we serve as role models. We serve as a powerful voice in the community, and it's often associated to other things. But today, let's use that voice more responsibly. Dr. Jack?
Yeah, thanks again, Sue. I think we are talking about this cervical cancer like it's mainly a women challenge.
Yes.
But anything that affects women affects all of us.
Absolutely.
Affects the entire society. Most times when a woman gets the cervical cancer, they are at the prime of their ages. they'll most probably leave young children, and their productive contribution in the society is lost.
Absolutely.
And so as men, I think we should join the team and not allow it to be half the team, that is women striving to do this on their own. So the women are our wives, they are our girlfriends, mothers, sisters, aunties, etc. Let's cascade the messaging in our different ways. Speak to them. The screening, have you done it this year? And just keep talking about. I like what you say. You said you are a daughter's father, so you have a responsibility.
No,
starting right there.
absolutely.
Yes, and so do all of us to share the messaging. And one of the things you said that I really like is the fact that it's, at the end of the day, it's not a medical doctors or health workers challenge. It's a whole of society.
Yeah.
We need to create one big coalition and make sure that the women, the young women, are helped to understand what they need to do and where to get the service. And on our side, as a healthcare provider, provide a service that meets their standards.
Yeah, absolutely. Absolutely.
Oftentimes, people come to the facility and maybe they stay too long in the facility, and people have lives.
Yeah.
So you want to make it as swift as possible, as inconveniencing as possible. So that's on us as healthcare providers. But for the rest of the society, fathers, uncles, let's join in and support the women.
Fantastic. Let me offer you the platform.
Yeah, thank you, Swift. Adding to what Jared has just said, as men, we have platforms and various platforms where we meet, where we get to talk about issues. And we know again that as men, we don't have very good health-seeking behavior. And
very true.
Now,
I'm guilty of that.
For us for men to really drive the point home with regards to cervical cancer, we need to educate them, because they need to speak about something that they understand. They need to know exactly how this affects them, when it affects their girl child, when it affects their wife, their girlfriend. They need to know how it cycles back and come back to them as a head of the family or as a partner to this female. So I think we still need to do more in educating men for them to contribute more and better to actually supporting and encouraging women to actually take up the service.
Absolutely. I view it as we're both in one boat. One hand is a male, the other hand is a female's. If we don't row together, we're not going to move forward. If only one rows, then we move in a circle. Whether we like it or not, I think it's an important conversation. And I sincerely hope that we sparked someone's thinking and gave you some food for thought to say, this topic of cervical cancer, there is a system and a search engine called Google. You know what I'm saying? You can go on and just Google cervical cancer. What does this mean? And how is it affecting my life? And just educate yourself out here. There's nothing sissy about it. It's an important conversation to have, because at the end of the day, and I'd also like to challenge you to ask your significant other, when was the last time she had a pap smear? Check in on your daughter. Let's have these conversations, because at the end of the day, you'll definitely be saving a life. Gentlemen, thank you so much. And on behalf of Botswana, thank you so much for the great work you're doing. I believe that, health workers are unsung heroes, and, we need to continuously celebrate you and thank you. Thank you so much for popping by and being part and parcel of the Stars and Stripes show.
Thank you.
Thank you. And remember, Education USA is available for you. You can go to www.usembassy.gov and find out more information about studying in the United States. Remember, if you're an NGO player or you're part and parcel of civil society, the U.S. government, in partnership or in collaboration with the U.S. Embassy Gaborone, Botswana, has a number of ongoing grants. All you have to do is like, share, and interact with their social media platform. And of course, you can get a lot of information about that. Please go like, share, and interact. And let me tell you something. If you'd like to study in the USA, the US government also offers a service through Education USA where you can simply email and book yourself an appointment and get to learn and understand some opportunities to study abroad. Ladies and gentlemen, kings and queens, Samantha, last words to the men.
Last words to the men. Please support Bomme by Longkwara in your lives.
Aish, nice, short and sweet. Maybe we'll invite you to the men's conference. Well, I think not.
The Stars and Stripes show was brought to you by the US Embassy.